Sapporo criteria, which was given in the year 1999. Later, this has been modified and given as the Sydney criteria in the year 2006. This has two broad headings in the criteria. One is the clinical criteria, one is the lab criteria. Any one clinical criteria and any one lab criteria is required for diagnosis. In clinical criteria, we have first is the thrombosis. Now, thrombosis can be arterial, venous or small vessel, which is confirmed by imaging or Doppler studies or histopathology. Next is any adverse obstetric event like more than equal to 3 pregnancy losses less than 10 weeks of gestation, or more than equal to 1 fetal death more than 10 weeks of gestation, or more than equal to 1 preterm birth which was less than 34 weeks of gestation associated with severe preeclampsia or abruption. Now, I hope you understand and you can correlate. When I spoke about the pathogenesis of APLA in pregnancy, why I specified about the vascular thrombosis at the placental level and vascular disruption, which again you can see is related to severe preeclampsia and abruption. Coming to the lab criteria, again lab criteria includes your 3 major antibodies. As I said, lupus anticoagulant, anticardiolipin antibody, anti-beta-2 glycoprotein. Remember that anti-cardiolipin and anti-beta-2 glycoprotein, it can be IgG or IgM, which is present in medium or high titer. This test has to be done 12 weeks apart and repeated. Only if 2 tests are positive, then only we will call it as a positive lab criteria. So remember that it has to be repeated. So one APLA testing for antibodies, if you get it positive, you are supposed to repeat for the antibodies again 12 weeks apart. So one clinical and one lab criteria when present, you will give the diagnosis of APLA.